Hello, Eastview Scholars, and welcome back to Sharp Shorts. We just went through a very brief look at integument, its purpose, and layers and what it does, and also tissue repair. In this little tutorial, we're going to take a quick look at some of the disorders that can occur, and then also a very quick look at the accessory organs, the hair and stuff like that. Starting with stuff that is very unfortunately common to most folks, at least in having experienced different cancers. Certainly with the integument then and the exposure to the sun and the UV radiation and other carcinogens out there, skin cancer is a concern, and there's really three of them, as illustrated right here. The least dangerous, on your scale of dangerous, is the basal cell carcinoma. It is the most common from UV radiation. And as you can see, it originates in the basal layer, in the stratum basale, in response to that UV radiation. Now, it is extremely rare to metastasize, and most people do survive. Now, an odd question in that, then with folks, is do I need to get it removed or fixed or taken care of or have the surgery? Well, the short answer is yes. While it is very rare that it will metastasize and travel and cause other issues, it can. But more importantly is just as that tumor goes and maybe ulcerates and starts to bleed or causes damage to the skin below, and for example, anywhere in the facial area, of course, these things are really triggered by sun, so it's sun-exposed areas. But folks who have let it go, their mouth has turned into a snarl and stuff, and they've done damage to the areas with the growth of the tumor. So while it's the most common, and people don't usually do anything for many years because it doesn't look like it's growing or going anywhere, yes, you do want to remove it because it may metastasize at some point. Our next in the scale of things are the squamous cell carcinomas. And again, these are sun-exposed areas. Now, what happens here with the squamous cell is it kind of starts in the spinosa layer, which is the last living layer. Well, let's put it this way, last dividing layer, because then when you hit the granulosum, those living cells are not supposed to be dividing. They're supposed to be producing the keratin and getting ready to keratinize that squamous epithelium. Also in the spinosa layer are the dendritic cells, which are there for the immune system and stuff. So they look rather similar to basal cells, but there are some differences. We'll show you some pictures in a minute. There are some differences as a scaly red as opposed to a shiny dome around and stuff like that. They do happen in the same areas, but those certainly will metastasize if not removed, and can become quite dangerous. Of course, the one that is of greatest concern, that is, how should we say it this way? It's the most dangerous while it's the least common. But it is cancer of the melanocytes, the malignant melanoma, and part of that danger is because it's melanocytes. It can occur anywhere where there is pigment. You can have that, whatever that trigger is for the uncontrolled growth of those melanocytes, which of course again are in the stratum basale, and the key to it is early detection. They very rapidly, because of their location, etc., and what in the production of the pigment to protect your skin, which is what the melanocytes do. If it's not detected early, then the survival rate goes down because it can spread very easily through the lymph system. Again, it's on the basal layer right above the connective tissue. The melanocytes produce melanin. As we talked about in class, everyone has the same number of melanocytes, regardless of skin tone, skin color, race, ethnicity, whatever it is. It's the melanin production of those melanocytes that makes the difference in skin color, along with keratin and blood vessels and the other things that go to skin color. The concern here is that, of course, with the UV radiation and the damage and that being part of the trigger producing the pigmentation, that constant bombardment of those melanocytes is what one of those triggers are. Since it can happen anywhere where there's pigment, it becomes very dangerous. Let's look at some pictures. Here's a basal cell carcinoma. You can see on the right where it has ulcerated. And again, can't answer why you would let that go. But again, you may see something like the left-hand side that may be there for a long time. And while it may not ever metastasize, it is still something you want to get removed. Here, of course, is a squamous cell carcinoma, and what you can see, I put two side by side, so you can see that while they can look very similar in their ulceration and everything else, you see the difference between the shiny papilla and the dark one here. And of course, there's the malignant melanoma. There's benign, there's a mole or freckle, whatever you want to call it, and it has now become malignant and looks like a dark spreading patch, and that is, of course, dangerous. So, one thing to make sure you do, whether it's studying for this exam or studying for life, is know the ABCDs of melanoma, the asymmetry, the border irregularity, the coloration, and the diameter. Okay. The other big disorder we would look at are burns. Now, we won't necessarily look at them as burns covering the body. There is diagrams that you can look at for degrees of body, and areas of the body are more important than other areas as far as damage that can occur. I shouldn't say more important, but are of more serious concern. And so when you hear reports of so much of the body was burned, it's not kind of a one-to-one scale. What we're going to look at is what it means in damage to the integument, and what you can see here is it all is based on how much of the integument is damaged. Starting with first-degree burns, there's your sunburn right there. It only damages that epidermal layer. Localized redness, swelling, some pain, but usually heals in 2 to 3 days without any issues. Okay, and there you can see it really was just damage in the epithelial layers, and there's the sunburn. Okay. Second degree burn is the injury to the epidermis, and you can connect part of the dermis. And yes, you can sunburn and get blisters, so that means you've done a pretty good job. Mimics first degree with the blisters, heals in 3 to 4 weeks. And if you don't get an infection because you have dipped into that dermal layer, in a sense, gotten starting to decrease your defense area, there can be infection and scarring and stuff that can occur. And there, what you can see here by this illustration is you have dipped into the dermal layer. Certainly painful because you've burned some of the nerve endings and stuff and done some damage to the papilla and the vessels that are there. Okay, and there are some examples you can see of some blistering and stuff to a hand. Or a few different hands. There's a little skin issue. Okay. Third degree is the worst one. That is the full thickness burn. Of course, that means you've taken care of the whole cutaneous membrane, the epidermal layer, the dermal layer, into the hypodermal layer. And initially, of course, there's very little swelling or anything and no pain because you've burned through that dermal layer where all the vascularity in the nervous tissue is. Certainly, of course, it's a big concern because now you have completely taken away your protection from the outside world. There is no separation, so infection's a big concern. You do not have the keratinized epithelium, so fluid loss and dehydration is a big concern, along with the concerns of the damage that it cannot be repaired by your system, which would take surgical repair to do. Okay, and there's the illustration as you've gone in the hypodermal layer, which again isn't going to help because the fat will be producing a lot of energy, and that will continue to create damage. Okay, and there you can see a couple of pictures some serious. Now the accessory structures, I'm going to go through these quickly. These are all extensions of the epidermis. They're all epithelial tissue stuff produced for different things. It's the hair, it's the glands, which are exocrine glands, which mean ducted glands, which send out their what they are releasing through ducts, as opposed to endocrine glands, which release their stuff into the bloodstream, and the nails, which are there to protect. And we'll do this quickly because they are just epithelial tissue extensions. The hair, found mostly over the body, now not as much for warmth for you, but it does allow for sensation of insects and protecting from heat loss, physical trauma, sunlight, protecting the eyes, filtering particles as you breathe through the nose, and stuff along that structure. But that's its deal. And oops, I lost my misplaced my hair that talks about the growth rate. Hair has a up to a 5-year growth rate, and then it will go dormant. And with the numbers of hairs that you have on your head, everything else, they don't grow all at the same rate, but you can look that up in your book. Nails, of course, a hardened, real keratinized layer of the epithelial tissue that's there to protect the dorsal surfaces of tips and toes and help from distortion of the digits under physical stress. Of course, your feet are supporting your body, your hands, but they're all very sensitive areas, as they are those that either judge your being upright and movement and the things you're stepping on, or protection from your hands, which you use essentially as tools. Okay. They also can be very much a diagnostic feature if you look at the color of the lunula and the nails themselves. And then, of course, the big thing, really, and part of it is for temperature regulation, and some of it is for protection and everything, are the glands that are associated with your skin. And you can use your book to look at how they are classified and named there. It's on whether they have ducts in the shape of them. Okay. What I'm going to look at here is the types that you find in your skin. There's a couple. The sebaceous glands are the ones, and you'll see them attached to, are part of hair or hair follicles or whatever, but they release the oil, the more viscous of the fluids, onto the skin and lubricate the hair and skin and keep it soft. You can feel the oily, especially if you've ever used soap or say in the chemistry lab got a little sodium hydroxide on your skin that has neutralized the oils out. You can feel how soft and slippery your skin really is. But it lubricates it, skin and hair, so it's not rough. Slows water loss and low humidity, keeping that humidity in the skin there. And think of Minnesota winters when you have to use lotion to protect your skin because it's so dry out with low humidity. Most important thing is that oils that cover your skin are bactericidal to protect you, because again, your first layer and your exposure to the outside. These are helical glands, simple branched, and the releasing oil is called sebum. Okay, it gives you an idea, and you can see here the picture of the gland associated with the hair follicle. Okay, sweat glands, there's a couple types, merocrine, which are also known as eccrine, and those are the most prevalent in your body. Apicrine sweat glands are armpits, genital areas, and stuff like that, and what's produced is a little different stuff. Anyhow, water secretion and function to clean and protect, and also can have some bactericidal functions if need be with some enzymes and stuff. Okay, mentioned apicrine glands. Armpits, groin, stuff like that produce a slightly more viscous, complex composition, especially with activity and sweat. Think of your armpits sweating, body odor, is part of that thing, strongly influenced by hormones. So for the females, it would go in conjunction with your monthly cycle. The most prevalent, which we're talking about, are the eccrine or American sweat glands, found in most areas of the skin, especially around the forehead, the neck, the back, and stuff. And this is your thermoregulation and excretion of water and stuff, and some antibacterial action. But that's the watery secretion as you get active to thermoregulate the sweat and the water release, and trigger the evaporative cooling. Anyhow, that gives us a quick look at a couple of disorders and the accessory structures. Time to hit the review sheets and scholar on these few.